Hello, I'm Rebecca Roylance and I'm a breast cancer specialist at Barts Cancer Centre, one of Europe's most advanced centres for the treatment of cancer. If you've recently been diagnosed with breast cancer, you probably have many questions. During this short film, I'll be talking generally about the treatments available here at Barts Cancer Centre. Barts is involved in a full range of clinical trials aimed at finding new ways to treat breast cancer, from diagnosis through to new treatments. I hope what I say will be useful, but remember that if you have any worries at all, do talk to your own doctor or specialist nurse. While breast cancer typically presents with a lump, it is important to remember that not all breast lumps are cancerous. These days, most women are cured of their breast cancer if it is treated before there is spread. Treatment for early, localised breast cancer typically involves surgery followed by radiotherapy. Some women will also require hormone therapy, chemotherapy and targeted therapy. Surgery is usually the first treatment for breast cancer. Most patients undergo breast-conserving surgery. This is where just the lump is removed. Less commonly, a mastectomy is necessary. This is where the whole breast is removed. If it is necessary to remove the whole breast, options for reconstructive surgery will always be discussed with you. During your initial operation, your surgeon will need to remove one or more of the lymph nodes in your armpit. This is important to give more information about the cancer and any additional treatment you may need. Here at Barts Cancer Centre, we start by removing the nearest lymph node to the tumour. If it is cancer-free, this avoids removing more lymph nodes than absolutely necessary. This is known as a sentinel lymph node biopsy. Following surgery, radiotherapy is often given. This involves using X-ray treatment to the breast or chest wall to stop the cancer from coming back. It involves several weeks of daily treatments as an outpatient. Approximately 70% of breast cancers are hormone sensitive. This means hormones like estrogen may cause it to grow. If your cancer is like this, then you will be offered hormone therapy to block their action and reduce the chances of your cancer returning. Some women will require chemotherapy. This is typically a combination of drugs injected into a vein which work by destroying cancer cells. For breast cancer, you will usually have chemotherapy after surgery to reduce the chance of your cancer returning, and this will be before radiotherapy and hormone therapy. Some women will have it before surgery to shrink the cancer to make a breast-conserving operation possible. You will usually have your chemotherapy as a day patient once every 3 weeks over several months. The new chemotherapy area of Barts Cancer Centre has been designed to be as comfortable and relaxing as possible for patients. Biological or targeted therapy is the name given to newer drug treatments designed specifically to interfere with the way cancer cells grow. Some drugs, like Herceptin, are being used routinely. Barts Cancer Centre is also involved in trials looking at other new targeted therapies. Targeted therapy is usually used after surgery and sometimes with chemotherapy. Barts is one of only a select number of hospitals in the UK with an experimental cancer medicine centre. This gives patients fast-track access to new cancer treatments being tested in clinical trials. The aim of the Experimental Cancer Medicine Centre is to bring together laboratory and clinical research. It's important to remember your own doctor is there to help. Questions they will be happy to answer include: what is my prognosis? Which treatment is best for me? Are there any trials or experimental treatments you would recommend for me? Is there a specialist nurse or counsellor who can talk things through with me? You can also look at the following websites for more detailed information, including how to be referred here for treatment.